नहीं लिखा रहा ना, इसलिए तो ऐसे तो आता है रजत लिखा। Hello everyone, am I live? I hope I'm clearly visible, audible to you guys. So I welcome you all for today's session. A very good afternoon to all of you. I welcome you all for today's session. Am I visible? Am I audible? Yeah, I guess it's working. I am Dr. Priyanka Sachdev here, and today I am here to take hepatobiliary pathologies. So in hepatobiliary pathologies, in this session, I will teach you all about cirrhosis. We will be studying cirrhosis in this session, and I will teach you everything about cirrhosis in this session. So the various type of cirrhosis, we will start with alcoholic cirrhosis, then move to the pigment cirrhosis, that is hematochromatosis cirrhosis, then Wilson's disease, cirrhosis and Wilson's disease, post-necrotic cirrhosis, alpha-1 antitrypsin deficiency cirrhosis, and NASH. So all type of cirrhosis we will be discussing in this session. But before that, it's really important to understand the anatomy and histology of the liver so that you will have a better understanding for the topic. So just in the first 5 minutes or 10 minutes of the session, I will give you a brief review about the histology of the liver, and then I will move on the topic, that is cirrhosis. So in liver, I am going to cover in this series all these topics. I will teach you jaundice, I will teach you CVC nutmeg liver, cirrhosis, hepatitis, and tumors of the liver. So this is the session about cirrhosis. In this particular episode, I am going to teach you cirrhosis. We know that liver is the largest human organ. In the liver, two lobes are present. This is the right lobe of the liver, you can see. This is the left lobe of the liver, you can see. You can see right lobe is 6 times larger than left lobe. It is clearly visible in the diagram. The two lobes of the liver are connected with the help of a ligament. Actually, there are 3 ligaments. If you ask me anteriorly, the name of this ligament is falciparum ligament. It is the falciparum ligament which is connecting right and left lobe of the liver. Same ligament from the posterior surface of the liver. It is known as, you can see, ligamentum venosum. Posteriorly, it is known as ligamentum venosum, and inferiorly, it is known as ligamentum teres. So what I am saying here, I am saying right lobe of the liver is connected with left lobe of the liver with the help of the ligament. So name that ligament. If you ask anteriorly, what is the name of that ligament? If you ask from the posterior surface of the liver, what is the name of that ligament? And if you ask from the inferior surface of the liver, what is the name of that ligament? Anteriorly, the name of that particular ligament is falciparum ligament. Posteriorly, it is known as ligamentum venosum, and inferiorly, it is known as ligamentum teres. These are 3 important MCQs from the anatomy, right? After that, moving further, entire liver is covered by a capsule. It is known as Glisson's capsule. Entire liver is covered by a capsule. The name of the capsule is Glisson's capsule. Now, I want to explain you portal triad of the liver, without which I cannot explain you the topic ahead, the cirrhosis ahead. For understanding portal triad, it is must to understand the dual blood supply of the liver. We all know liver have a dual blood supply. But what is the meaning of dual blood supply? In this diagram, you all can see this is the liver. Can you see the liver? Liver is an organ like all other organs in the body, right? All organs in the human body receive pure blood from aorta. So liver is also an organ. So this is the left side of the heart. From the left auricle, left ventricle, this is aorta coming out. Can you see aorta? Pure blood is coming from the aorta via hepatic artery to the liver. So this is the first blood supply. First blood supply is pure blood supply to the liver via hepatic artery. That is the first blood supply, right? Now see here the complete GIT. Can you see the complete GIT here? This is stomach, esophagus, intestine. These are the veins of the GIT. Can you see? These are the veins of the GIT. All the veins of the GIT drain in portal vein. Drain in portal vein, and portal vein carries blood to the liver. So portal vein is the second blood supply to the liver. It carries impure blood to the liver from the GIT. So can you see the 2 arrows, the 2 blood supply? Please appreciate the 2 arrows. This is hepatic artery. This is portal vein. Hepatic artery is coming from aorta, the left side of the heart, carrying pure blood to the liver. And you can appreciate here is the portal vein carrying impure blood to the liver from the GIT. The 2 blood vessels are entering the dual blood supply. They supply the complete liver. They divide into capillaries and they supply the complete liver. After supplying the complete liver, exit is only one. There are 2 inlet, but exit is only one. So double supply, but both the blood is exiting the liver from one vein. And the name of that vein is hepatic vein. It is also known as central vein. Hepatic vein or central vein is the exit. Like all other veins, hepatic vein or central vein also goes in the right side of the heart for blood purification via SVC, IVC. And from the right side of the heart, it will go to the lungs for purification. So this is the 2 inlet and 1 outlet. Have you noticed? The blood is coming via 2 inlet. One is hepatic artery, one is portal vein. And exiting out of the liver via 1 exit, that is known as hepatic vein. Give me a thumbs up in the chat box if you got it. Akshay, JJ, Sufi, have you got it? Can I continue? Now, what is the normal function of the liver? In human body, what is the function of the liver? Liver is having cells known as hepatocytes. Can you notice here? These all are hepatocytes. And inside the hepatocytes, bile is synthesized. So here, bile is synthesized here. Inside the hepatocyte, bile is synthesized. Bile is required for emulsification of fat. So whatever fat we take in diet, the butter, ghee, cheese, so that is going in the intestine. And for the digestion and emulsification of fat, we require bile that is synthesized in the hepatocytes of the liver. So all the bile from all hepatocytes is gathered together, is accumulated together, and bile exit the liver with the help of a bile duct. And this bile duct will open in the duodenum, in the first part of the duodenum via ampulla of Vater. So now, what is the summary? In the summary, you can see in the liver 2 inlet, 2 outlet. 2 inlet is the dual blood supply and 2 outlet, one is vein, one is bile duct. So let me take a blank page. Let me draw a liver here. Can you tell me the double blood supply of the liver? First blood supply of the liver is hepatic artery carrying pure blood to the liver. Second blood supply to the liver is portal vein carrying impure blood to the liver from GIT. Portal vein is coming from GIT. Hepatic artery is coming from aorta from left side of heart. Everyone give me a thumbs up on this side. But exit is common. Both of them are coming, supplying the liver and exiting the liver from one common point, exiting the one from common point hepatic vein. Yes, Chungu, it is a hepatic vein, right? So hepatic vein is the common exit. And if you notice inside the liver, the bile is synthesized. So bile exit the liver via bile duct. So bile contain bile, right? Of course, bile duct contain bile, and remaining all 3 contain blood. 2 are, you can say 1 is artery, 2 are veins, right? So 2 are inlet. So this is the final diagram. This is the final diagram. Now I want to explain you portal triad here. The concept of portal triad. What is portal triad? I want to explain you that. Now among the 4 things, 3 are best friend. They always travel together. They never leave each other alone. The 3 travel as a tripod. Which 3? You can see 4 things here now. The 3 are best friend. Which 3? Which 3? So it's hepatic artery, portal vein, the dual blood supply. Hepatic artery and portal vein is the dual blood supply. Third is the bile duct. They always travel together, and these 3 constitute portal triad. These 3 enter and exit the liver from a common point, that is hilum. And after entering in the liver, their arteries also travel together. So let me show you. This is portal triad. Give me a thumbs up if you got the concept of portal triad. Have you got the concept of portal triad? What is portal triad? So what is portal triad? You can understand portal triad in this diagram. You can see this point. At this point, you can notice this is hepatic artery entering the liver. This is portal vein entering the liver. And this is bile duct coming out of the liver. These 3 always travel together. That's why they constitute portal triad. In the portal triad, there is no hepatic vein. The 4th one, hepatic vein is not a constituent of portal triad. Not only the main branches, main arteries and veins, their branches also travel together. Can you see these 3 are traveling together? This is hepatic artery, this is portal vein, and this is bile duct. They enter and exit the liver from a common point. And after entering inside the liver, their branches also travel together. They are the best friends. That's why constituting portal triad. So what is the definition of portal triad? You can see portal triad have 3 things. Triad means 3 things. One is hepatic artery, a branch of hepatic artery. One is portal vein, a branch of portal vein. And one is bile ductule, that is branch of bile duct. Everyone give me a thumbs up, right? So that is the portal triad. Now let me tell you the histology of the liver, that is lobular model. After that I am coming on the cirrhosis, right? So listen. Let me tell you the lobular model. Now this is the liver. Can you see in this diagram? This is the liver. If you cut the liver and see, entire liver is divided into multiple lobules. Lobules, the hexagonal lobules. Let me draw a few lobules to explain you the concept. So this is hexagonal lobule. Entire liver is made up of lobules. Entire liver is made up of lobules like this, right? So I cannot make it complete, but yeah. It is the complete lobules you can make everywhere. Now, at the center of all lobules, is hepatic vein. which is not included in portal triad. इसको अकेला छोड़ दिया था ना, बाकी तीनों ने. There were 4 things in the liver. 2 were entering, 2 were exiting. 3 were the best friends. They were making the portal triad. The 4th thing, that is hepatic vein, it is alone, so it is present at the center of the lobule, right? Hepatic vein. Now you got the meaning why hepatic vein is known as central vein, because it is present at the center of the lobule. This is the reason why hepatic vein is known as central vein. You got my point? Now at the periphery of each lobule, at the periphery, portal triads are present. At the periphery of each, I am drawing on only one, but everywhere portal triads are present. In the portal triad, one is hepatic artery. Hepatic artery is present. The second is the portal vein. It is present everywhere. And third is the bile duct, present everywhere. Third is the bile duct. So in all lobules, you have to draw the structure. You got my point? So this is the lobular model of the liver. You got my point? So you can see the same here. You can see the same here. Can you notice in this diagram, this is the central vein. Central vein is hepatic vein, which was not included in the 3 best friend. 3 ने जोड़ी बना ली, एक को छोड़ दिया था, right? So that is central vein. And at the periphery, you can notice these are the portal triad. In the portal triad, one is hepatic artery, one is portal vein, one is bile duct. Now, let me explain you the same concept here. Now, you all are attending the lecture from the beginning. I guess you can understand this diagram. Everyone see here. Where is the liver? This is the liver. Inside the liver, let me draw 2 or 3 lobules to explain you the concept. So, I'm drawing only 2 or 3 lobules here inside the liver. Actually, in the liver, million of lobules are there. I'm drawing 2, 3 to explain you. You can see 2 inlet and 2 outlet. You can understand what are the 2 inlet. One is hepatic artery, one is portal vein, the dual blood supply. And both the blood are coming, mixing and getting exit from a common vein known as hepatic vein. And bile is exiting via bile duct. We can see the 4 things. 2 are entering, 2 are exiting. Right? Among them, this central vein, this hepatic vein or central vein, it is present at the center of the lobule. This one. And the remaining 3, where are the remaining 3? Where are the remaining 3? That is portal vein, hepatic artery and bile duct. They are present at the periphery of the lobule. Here, they are branches I am talking about. So they are present, the branches travel together and they are present at the periphery. Give me a thumbs up if you got the overall concept. So here also in this diagram, you can see here is the central vein and at the periphery, these are the portal triads. Appreciate the portal triad. Appreciate the portal triad. So what is the classical lobule? In a classical lobule, the center have the vein, hepatic vein, that is central vein. And at the periphery, portal triads are present. Portal triads include 3 things. We know hepatic artery, bile duct and portal vein. So this is the diagram. This is the diagram I have drawn for you. Everyone give me a thumbs up. Can you appreciate this diagram? We will understand all type of cirrhosis in this diagram. So first understand this diagram. In this diagram, you can see a lobule of the liver. Say yes or no. Of course, you all can see a lobule of liver. At the center, you can see a vein. At the center, you can see a vein. This is central vein. This is central vein or hepatic vein. You can see this is central vein or hepatic vein, whatever you call. At the periphery, you can appreciate the portal triads. This is hepatic artery in each triad. This is portal vein in each triad. This is bile duct in each triad, in each of them. So this is portal triad. Is it true? Is it true? Right? Now, who is connecting? The next question. Who is connecting the central vein with the portal triad? Who is connecting? So the cells of the liver. The cells of the liver are known as hepatocytes. The cells of the liver are known as hepatocytes, and these hepatocytes, they form a row. They form a row one behind the other. They arrange themselves one behind the other. Hindi में कहें तो एक दूसरे के पीछे. So it is like the train. Have you traveled in the train? The bogies of a train. Have you traveled in a train? There is an engine and just behind that the bogies in the train. It is like one behind the other. One behind. So this arrangement is known as cord-like arrangement. So the cells are arranging one behind the other like a cord, and this arrangement is known as trabecular arrangement of the cells. So you can see the cells, the hepatocytes, they are arranged one behind the another like a cord-like arrangement or trabecular arrangement, connecting the central vein with the portal triads. Give me a thumbs up. Give me a thumbs up. Now between 2 adjacent trains, see the next diagram. Can you see the next diagram? In the next diagram, you can appreciate between 2 cords. This is the first cord, this is second cord, this is third cord. The entire liver is full of cords. Between 2 adjacent of the capillary sinusoid. Can you see here there is a capillary, here there is a capillary, and the capillary is sinusoid, and that is lined by endothelial cell. So I would like to take a blank page, and on the blank page I would like to draw 2 adjacent rows or trains of hepatocyte or cords of hepatocyte. So this is the first cord of hepatocyte. Can you see this is first cord, the cord of hepatocyte. So these cord of hepatocytes are connecting central vein on one side with portal triad on another side. Am I right? Am I right? I'm saying between two adjacent cords, there is sinusoid. What is sinusoid? Sinusoid is a capillary. It is lined by endothelial cells. So endothelial cells are there. Apart from endothelial cells, few macrophages are present. Few macrophages are present. The macrophages of the liver are known as Kupffer cells. So scattered Kupffer cells are present inside the sinusoid. So sinusoid have two type of cell, the endothelial lining along with Kupffer cell. Everyone give me a thumbs up. Everyone give me a thumbs up. Now, okay. I want to tell you about a space. Again, I have to draw the diagram. Just a second. Give me a minute. Okay. It's not working. I want to use the highlighter, but I don't know the key to use the highlighter. Anyways, okay. So again, I would like to draw the same diagram. I want to show you a space. What is space of Dissay? So this is the first row of the hepatocyte you can see. This is the second row of the hepatocyte you can see. Between two adjacent rows of hepatocyte, I told you this is a sinusoid. Inside the sinusoid, these are the endothelial cells lining the sinusoid. Apart from endothelial cells, there is Kupffer cells, scattered Kupffer cells, that is macrophages of the liver. Can you see a space? What space I'm talking about? I'm talking about this space. Can you see a space between the cord of the hepatocyte and the sinusoid? Can you see the space? The space between the cord of hepatocytes, trabeculae of hepatocytes and sinusoid. This space is known as space of Dissay. What does it known as? It is known as space of Dissay. Inside space of Dissay, a special cell is present. A special cell is present. This cell is known as ETO cell. This cell is known as ETO cell. So ETO cell is present in space of Dissay. Yes, in the space of Dissay, ETO cell are present. So it is a normal cell. It is present in all normal healthy human beings, in you, me, everyone. So what is the function of this space of Dissay? What is the function of this ETO cell? ETO cells store vitamin A. Normally, they store vitamin A. They store vitamin A in all of us. So this is the normal diagram. Have you got it? One more thing I would like to tell you here. Whenever the hepatocytes are injured, now I'm going to teach you cirrhosis. In cirrhosis, I will teach you that hepatocellular injury is there. Can you see? These are the hepatocytes. If something is causing injury to these hepatocytes, the injury can be caused by alcohol in alcoholic cirrhosis, it can be by iron, it can be by copper, it can be by any injurious agent. If these hepatocytes are undergoing necrosis, so ETO cell will get stimulated. At that time, ETO cell will get stimulated and ETO cell will convert into myofibroblast cell at that time. And they start forming collagen. So collagen will be synthesized by them. Normally, ETO cells do not synthesize collagen. They synthesize collagen when they get stimulated. They get stimulated, the stimulus, the trigger for the stimulus for ETO cell is hepatocyte injury by any injurious agent. So ETO cell will convert into myofibroblast and start forming collagen. Collagen means fibrosis, and fibrosis of the liver is cirrhosis. So you got it now why cirrhosis take place. So I will explain you again while I will teach you the pathogenesis of cirrhosis. First, everyone give me a thumbs up. Have you got it? So this is all about the normal histology of the liver, right? In the normal histology of the liver, you found out what is space of Dissay. Now one more thing. Can you see this? From this train, this is the first hepatocyte. From this train, this cord, this is the first hepatocyte. From this cord, this is the first hepatocyte. So first hepatocyte of all the cords, it is known as limiting plate. It is known as limiting plate. You should understand the concept of limiting plate. Limiting plate are the hepatocytes which separate portal triad from remaining hepatocytes. So this is known as limiting plate. You must understand the concept of the limiting plate also. Sinusoids, I have already told you, sinusoids between two adjacent rows of hepatocytes, between two adjacent cords of hepatocytes, these sinusoids are present and these are lined by endothelial cell and flattened Kupffer cells. So in this diagram, you can see this is the first row of hepatocyte. Can you see the first row of the hepatocyte? This is the first row of hepatocyte. In this diagram, you can see the second row of the hepatocyte. This is the second row of the hepatocyte. Between the two adjacent rows of hepatocyte, you can notice a blood vessel. This is a blood vessel, that is sinusoid. It is lined by endothelial cells, right? It is lined by endothelial cells. And this cell is Kupffer cell. This cell is Kupffer cell, right? It is a macrophage and this is Kupffer cell. Now you can notice the space. I'm talking about this space. Okay, this space is space of Dissay. Can you notice space of Dissay? And the space of Dissay, yes, this cell is ETO cell, right? Everyone give me a thumbs up if you got everything. The last point to be noticed here is one more point I want to explain you. Can you see between adjacent rows of hepatocyte? Okay, see this row. See this row of hepatocyte and this row of hepatocyte. Between adjacent rows of hepatocyte, the two hepatocytes are connected with each other. The two hepatocytes are connected with each other with a hole or with a gap. The hepatocytes are connected. Have you ever traveled in train? In the train, have you traveled from one bogie to another? There is a connector, small connector connecting the two bogies. In the same way, if we consider the row of hepatocytes are train, the two bogies, the two hepatocytes are connected in between with a small connector in between. Give me a thumbs up. Why this connector is given? So all these hepatocytes are synthesizing bile. So whatever bile synthesized here is transmitted to the next, is transmitted to the next. In this way, all the bile will be collected to the bile duct. So that is the reason. Now this is the final diagram of the liver. You can see this is the final diagram of the liver. In the liver final diagram, okay, just a second. I would like to draw the lobule. In the lobule, in the center, we know there is central vein or hepatic vein. This is hepatic vein or central vein, right? And at the periphery, these are the portal triads. There are 6 portal triads. Each portal triad contains hepatic artery, portal vein, bile duct. So three structures are present in each of the triad. While forming the diagram, I will draw one central vein, and out of the 6 portal triad, I will draw only one. Any one can be drawn. I always will not draw all 6. So this is the final diagram. In this diagram, you can see this is the central vein of the liver, right? Central vein present at the center of the lobule. You can see this is the portal triad. It is present at the periphery. 6 portal triads are there, but I have drawn only one. Inside the portal triad, you can see this is hepatic artery, this is portal vein, and this is bile duct. So 3 structures are present. See the background. The background has small connective tissue. You can see the cord of hepatocytes connecting them. So that is the cord of hepatocytes connecting the central vein with the portal triad. These are the cords of hepatocytes you can appreciate here. Sinusoid space of disease is not shown here. You know between two adjacent cords sinusoids are present in space of disease, etocell, you know everything. The first hepatocyte. Where is the first hepatocyte? Let me mark. The first hepatocyte of the cord, of all cords, the engines you can say. It is forming a plate known as limiting plate. Everyone give me a thumbs up. Shall I move ahead? Shall I move ahead? Say yes or no. So Sufi, Nesty, Chungu, Gamma Knife, I can't see other names. Shall I move ahead? Give me a thumbs up. Everyone give me a thumbs up. So if you got the normal histology of the liver, let me start the disease, cirrhosis. Are you people there? Shall I start cirrhosis? Give me a thumbs up in the chat box. Shall I start cirrhosis? So what is cirrhosis? Now let me help you in understanding what is cirrhosis. What is cirrhosis? Okay. Just a second. Also, we define cirrhosis under 4 points. These are the 4 points which define cirrhosis. Cirrhosis is a disease which involves entire liver. Can you see? It is not a disease which involves one portion of the liver. Just suppose this is the diagram. You can see this is a diagram of liver. It is not a disease that it involving one of the portion of the liver, any portion. If it is the case, if it was involving one of the portion of the liver, the treatment of cirrhosis is the surgery of that portion, like the tumors of the liver or any other disease of the liver. If it involves focally, we can surgically remove that abnormal area. But cirrhosis is not a disease which is focal. Cirrhosis is a disease which is diffuse and it involves the entire liver. That's why surgery is not the treatment of cirrhosis. For the treatment of cirrhosis, liver transplant is the only treatment available. The complete liver have to be removed and new liver have to be transplanted from the donor. So liver transplant is the only treatment of cirrhosis. This is the reason. You can see in this diagram, this is a cirrhotic liver. In the cirrhotic liver, you can see the entire liver is involved. It is not focal. The disease is diffuse. So the first point you must understand, it is a diffuse disease, not focal. Give me a thumbs up, right? That is the first thing. Now, what is the definition of cirrhosis? What is the normal architecture inside the liver? As I have told you, inside the liver, lobules are present, which are the hexagonal lobules. Inside the liver, hexagonal lobules are present, right? This is normal liver. This is normal liver. In cirrhosis, this is lobular model, the normal lobular model. In cirrhosis, lobules are gone. They are collapsed. They are collapsed. The lobules are gone. And liver get converted into nodules. Instead of lobules, multiple nodules are formed. So that is the definition of cirrhosis. This is cirrhotic liver. This is cirrhotic liver. So in cirrhotic liver, lobular model is collapsed and nodular model will come. So that is the definition. Now you will ask me why it is happening. So I will teach you the pathogenesis of the cirrhosis. Don't worry. First now the definition. So what is the definition, you tell me? I told you that normal lobular architecture is collapsed. It is collapsed, it is disorganized, it is no more. It is no more. And now there are formation of lobules. Multiple lobules are formed. Multiple lobules are formed. Can you see this is the definition of cirrhosis? You can see the definition of cirrhosis. Now you will never forget. In this definition, you can see the normal lobules. This is the normal lobular model, right? At the center, you can see central vein. At the periphery, portal tract. This is all gone. This is gone. And liver get converted into multiple nodules. You can appreciate multiple nodules. The nodules are separated from each other by fibrous septa, which is very important in the definition. So fibrous septa must be formed. This is the fibrous septa. Can you see all these are fibrous septa which are separating the nodules from each other? So what is the definition? Cirrhosis is a disease which involves entire liver. Normal lobular architecture is gone and nodular architecture will come. So that is the definition of cirrhosis, right? That is the definition of no changu. I'm not saying lobes. I'm saying lobule. Liver have two lobes, right and left lobe. I'm saying that lobes to honge. वो नहीं कह रही हूँ मैं. The lobes will be present, right? But lobules, the liver is having a hexagonal lobular model. Now that is gone. Now coming on the pathogenesis, why it is happening? Why? The question arises why lobular model gets converted into nodular model. Why? Why? The reason for why I have to tell you the pathogenesis of cirrhosis. So in the pathogenesis of the cirrhosis, there are 3 steps we will be studying one by one. The first thing which starts cirrhosis is the hepatic injury. There should be a injurious agent which should cause hepatic injury, hepatocellular injury. So injurious agent can be alcohol in case of alcoholic cirrhosis. The injurious agent can be iron in case of hematochromatosis cirrhosis. The injurious agent can be copper in case of Wilson's disease. The injurious agent can be viruses, that is hepatitis A, B, C, D virus in case of post-necrotic cirrhosis. So injurious agent can differ, but the ultimate thing, injury is there, right? So what I have told you, I would like to draw the same diagram, normal diagram of the liver. You tell me in the normal diagram of the liver, there is a lobule which is hexagonal lobule. At the center of the lobule, there is central vein. We all know that. And at the periphery of these lobules, 6 portal triads are present. We all know that. Now I will explain you why this model is gone and nodular model is coming. Inside the portal triad, one is hepatic artery present everywhere. One hepatic artery. One is portal vein present everywhere. Second is portal vein, hepatic artery, portal vein, and third is the bile duct. So this is the portal triad you can see. Everyone doing a thumbs up. Connecting cords. Connecting. So what is the connection between the central vein and the portal triads? It is the row of hepatocytes. So cord of hepatocytes connect the central vein with the portal triads everywhere like this. Now between two adjacent cords, sinusoid is present. Let me draw a sinusoid anywhere. It is present everywhere. It is lined by endothelial cells along with Kupffer cells, and this space is space of Dissay. You can see this space is space of Dissay. Space of Dissay is the space between the cords of hepatocytes and the sinusoids inside which ETO cell is present. So let me draw a ETO cell here. Let me draw a Just a second. Let me draw ETO cell here. Right. Give me a thumbs up if you all can understand this diagram. This is normal. I have already explained. Now I am saying hepatocellular injury is taking place. Let me elaborate this diagram on the next page to explain you cirrhotic model. So in the cirrhotic model, these are the 2 rows of hepatocytes I am drawing. These are the 2 rows of hepatocytes I am drawing here. This is the first row of hepatocyte. This is the second row of the hepatocyte. Right. Between 2 adjacent rows of hepatocyte, you can notice this is the sinusoid, which is lined by the endothelial cell, right? These are the endothelial cells lining the hepatocyte along with few Kupffer cells, right? Okay, these are few Kupffer cells. Yeah, the space is space of Dissay. Yes. So there is a cell present in space of Dissay which is known as ETO cell. So let me draw a ETO cell. So this is a ETO cell I am drawing. Now, let me explain you the mechanism of cirrhosis. Now, you can understand this diagram. In the mechanism of cirrhosis, there is an injurious agent which is causing injury to these hepatocytes. The injurious agent is causing hepatic injury. So, it can be alcohol, it can be iron, it can be copper, it can be multiple virus, any injurious agent, right? That injurious agent is causing injury to the hepatocyte. So, imagine this hepatocyte is dead. This hepatocyte is also dead. This is dead. So most of the hepatocytes are dead. Sirf ikka dukka few are surviving. But most of the hepatocytes are already dead. Only few are surviving due to the injurious agent. So the complete lobule will be collapsed now. The complete lobule will be collapsed, right? at the time of the injury, whenever I have told you that injury take place to the hepatocyte, E2 cell will get stimulated. So this is the E2 cell. You can see here, this is the E2 cell. It will get stimulated. This E2 cell will get stimulated, and this E2 cell will get converted into myofibroblast cell and start forming collagen. It will start synthesizing collagen. So imagine all these cells are forming collagen. This is the collagen formed by all these cells. Collagen is the fibrosis, right? So ultimately, what will be the model of the liver? Now, can you see where is the normal lobule is there? Where is the normal? Now this lobule is collapsed now because all the hepatocytes here. Imagine the row, this row, out of the row, three are dead, only one is surviving. In this row also, most of them are dead, only few are surviving. In this row also, most of them are dead, only few are surviving. So complete lobule will get collapsed. Say yes or no. It will get collapsed now. So lobule को expand किसने करके रखा है? The row of the hepatocytes. अगर ये सारे row of hepatocytes will be dead, most of them will be dead. So the lobule will collapse like a balloon. It will collapse. Give me a thumbs up. Now few are surviving. Mind my words. Few are surviving hepatocytes. Not all hepatocytes are dead. Ikka dukka few. 10% will be surviving. Those 10% who are surviving, they will regenerate. They will do the proliferation. They will do the mitosis, and they will compensate the loss of the hepatocyte. They will do hyperplasia. They will divide. They will try to compensate. But again, lobule cannot be formed. The lobule is gone. Lobule to chala gaya because all the hepatocytes, maximum 90% are dead. So the lobule is collapsed. Now the surviving one will divide and they will form nodule. The surviving one, that's why lobule get converted to nodule. So the surviving one, the surviving hepatocytes which are not dead by the injurious agent, they will do regeneration and they will try to compensate and they will result in formation of nodule. So ultimately, these are the multiple nodules formed like this, inside which multiple hepatocytes are present. All these hepatocytes are formed from the surviving one which are doing hyperplasia. They are doing compensatory mitosis or hyperplasia. You got my point? So from those few were surviving which are doing hyperplasia and forming the nodules. These nodules are separated from each other by fibrous septa. This is fibrous septa. Who is forming this fibrous septa? Fibrous septa is made up of fibrosis. Fibrosis is made up of collagen, and this collagen is coming from myofibroblast. Myofibroblast, that is E2 cell. Everyone give me a thumbs up. Everyone give me a thumbs up. Yes, Chungu. These are the same myofibroblasts which are present in bone contraction. The same one. In bone contraction also, their job is formation of collagen. Here also their job is formation of collagen. But here E2 cell get converted into myofibroblast. Normal E2 cell do not form collagen. But whenever hepatocellular injury is there, they convert into myofibroblast and they start forming collagen. Give me a thumbs up. Give me a thumbs up. So what is the pathogenesis of cirrhosis? Who will tell me? Why cirrhosis takes place? How cirrhosis takes place? So continuous destruction of the hepatocyte. If the hepatocytes have continuous destruction by any injurious agent, so it will lead to collapse of the lobular model. The lobular model of the liver is gone, right? It will cause stimulation of the E2 cell. E2 cell will convert into myofibroblast cell, right? They will start forming collagen. There are 6 types of collagen. Collagen type 1 and 3 will be formed. And this will lead to fibrosis. Now, the surviving hepatocytes, they will regenerate, they will proliferate, they will do more and more mitosis and hyperplasia, and they will form the nodules. So ultimately, nodules are formed which are separated from each other by fibrous septa. Have you got it? What is the mechanism? Have everyone got it? Do you have any doubt? Otherwise, give me a thumbs up in the chat box. Shall I proceed ahead? Coming on the classification of cirrhosis. Till now, we have studied cirrhosis, right? We have studied the definition of cirrhosis. What is cirrhosis? We have seen the definition of cirrhosis. After the definition of cirrhosis, we have seen the pathogenesis of cirrhosis. After the pathogenesis of cirrhosis, now I am teaching you classification of cirrhosis. Shall I continue with classification of cirrhosis? So in the classification of the cirrhosis, there are 2 types of classification: morphological classification and etiological classification. Morphological and etiological, there are 2 types of classification. Let me teach you first morphological classification. In the morphological classification, 2 types of cirrhosis are there based on the morphology, based on the size of nodule. If all the nodules are less than 3 millimeter, it is micronodular, and if all the nodules are more than 3 millimeter, it is macronodular. Can you see in this diagram? In this diagram, all the nodules are less than 3 millimeter. Millimeter, it's not centimeter, 3 millimeter. That's why this cirrhosis is known as micronodular cirrhosis. And here in this diagram, you can see all the nodules all the nodules are more than 3 millimeter. That is macronodular cirrhosis. You got my point? So micronodular and macronodular. Have you got it? What is micronodular? All the nodules are less than 3 millimeter. And what is macronodular? All the nodules are more than 3 millimeter. So Chungo, you want me to tell again, pathogenesis again. Okay, listen. Listen what is happening. Just a second. Okay. So there are in the liver, lobules are present. Hexagonal lobules are present in the liver. There is some injurious agent who is coming. The injurious agent can be anything. You know the list. It is alcohol, iron, copper, anything. That is causing injury to the hepatocytes. Once the injury to the hepatocytes occur, two things will happen. Number one, the lobules will collapse because the hepatocytes are injured now. They are dead. So lobules collapse. The lobules to collapse ho gaya because of the injury to the hepatocyte. On the other hand, injury will stimulate. Okay, let me finish this. Most of the lobules are collapsed, but few are surviving. Few are surviving hepatocytes. सब नहीं मरते हैं. 90% will collapse, but few, the 10% are surviving. You can say surviving hepatocytes are there, right? The 10% are surviving approx. These 10% will regenerate, and they will form the nodules, right? So this is how you can say. This is how you can say lobules are gone and nodules are arising, right? Because of the hepatocellular injury, most of the hepatocytes from the complete cord, there are 10 bogies in a train. Out of the 10 bogies, the 8 are destroyed. Only 2 are remaining. So the lobular model will collapse. In all the cords, it is taking place. So lobular model collapse and the surviving hepatocyte will regenerate. They regenerate and they form circles. That is the nodules. That is the first thing. Second thing, due to injury, E2 cell will get stimulated. E2 cell will convert into myofibroblast. Myofibroblast will form collagen and collagen will lead to fibrous septa. It will lead to fibrosis. So multiple nodules are formed which are separated by fibrosis. This is the definition of cirrhosis. So what is a cirrhotic liver? In cirrhotic liver, you find multiple nodules separated by fibrosis. So you should be able to tell me nodule kahan se aaya aur fibrosis kahan se aaya. What is the origin? So ultimately, they are due to hepatocellular injury. Give me a thumbs up. Chungu, give me a thumbs up. Have you got it? The pathogenesis. Once again, I taught you. Shall I proceed ahead? Shall I proceed ahead? Give me a thumbs up. After that, I taught you the classification. In classification, there are two types of classification. The first classification is morphological classification. In morphological classification, there are two types of cirrhosis, micronodular and macronodular. In micronodular cirrhosis, all the nodules are less than 3 millimeter. In macronodular, all the nodules are more than 3 millimeter. Here you can see in this diagram, all the nodules are less than 3 millimeter. So that's why it is micronodular. In this diagram, you can see all the nodules are more than 3 millimeter. That's why this one is macro. It is 3 millimeter, not 3 centimeter. Yes. So it is 3 millimeter. We are done with morpho. Sometimes it is mixed also. Micro, macro, both are there. So morphological classification is done. It is micronodular, macronodular and mixed one. Coming on etiological classification, which is more important. Etiological, morphological classification based on size of nodule. Etiological classification based on the injurious agent who is causing injury. As I have told you, cirrhosis cannot occur without hepatocellular injury. There should be an injurious agent which is causing the necrosis of the hepatocyte. Say yes or no. There should be an injurious agent. So most commonly, the injurious agent is the alcohol. It is known as alcoholic cirrhosis. It is 70% of the cirrhosis is alcoholic cirrhosis only. So it occurs in chronic drinkers, chronic alcoholic drinkers. Right now, I will start this one only. Right. After that, it can be caused by viruses. It is known as post-necrotic cirrhosis. So it constitutes 10% of the total cirrhosis. The injury can be caused by bile, biliary cirrhosis. The injury can be caused by iron, known as pigment cirrhosis. The injury can be caused by copper. It is known as Wilson's disease. Injury can be caused due to alpha-1 antitrypsin deficiency. So various type of cirrhosis are there based on the injury. Now the point is that can we combine the two classification? Can you tell me which among these are micronodular and which among these are macronodular? Yes, can you? So yes, we have to do that. So micronodular कौन-कौन से हैं, macronodular कौन-कौन से हैं? In macronodular, learn only two examples. Only two examples. Number one, viral cirrhosis and Wilson's disease, copper wala. Viral and copper. That's it. These are the two examples of macro. Remaining all are micro. So learn. इसमें बहुत MCQs आते हैं. Right. Let me start alcoholic cirrhosis. Let me start alcoholic cirrhosis. Everyone give me a thumbs up. Let me see if I can see your chat. Give me a minute. Just give me a minute. Let me see if I can see your chat. You have to give me a second to open it on mobile also. It's in front of me on the screen. I can see, but I want to confirm it. Just a second. Okay. I guess I can see it. Yes. On the mobile also I can see it. Yes, I can see. Okay. So let me teach you alcoholic liver disease. What is alcoholic liver disease? What is alcohol, by the way? What is alcohol? Alcohol is a beverage. It is used as a beverage in chronic drinkers, right? In drinkers, they use alcohol as a beverage. There are two types of available in the market: methanol and ethanol. Yes or no? Methanol and ethanol, the two type of alcohols available in the market. Methanol is CH3OH and ethanol is C2H5OH. We have studied in the chemistry in your childhood, right? I guess I am right. Yes, right. So methanol is not a beverage. It is used for industrial purpose. And yes, ethanol is the beverage which is causing the cirrhosis. So this cirrhosis is caused by ethanol, right? So actually, what is the ethanol metabolism? First, you have to understand that. So I will draw the GIT of a person. This is the mouth, esophagus, stomach, and intestine of a person. Let me draw. This is the blood vessel of a person. This is the brain of that person. This is the liver of a person. Imagine a person is drinking ethanol. So this is the ethanol. Ethanol. He is a chronic drinker and he is consuming ethanol in large quantity. So all the ethanol is going in the stomach and in the intestine. From the stomach and intestine, it gets absorbed. It will reach in the blood. From the blood, it will go in the brain, cause stimulation of the brain, giving the pleasurable, addictable effect of the alcohol. And in high concentration, it will give it acts as a depressant of the CNS. Okay, I'm not interested in brain. I'm not teaching you CNS right now. Currently, I'm teaching you hepatobiliary pathology. So from the blood, it will go to the liver. From the blood, it will go to the liver. Now, these are the cells of the liver, hepatocytes of the liver. So this ethanol will enter inside the hepatocyte. Now, let me draw this hepatocyte separately. Inside this hepatocyte, two type of enzymes are present. So let me draw the two enzymes. The two type of enzymes are present inside this that will metabolize the ethanol. So on the next page, I will draw this hepatocyte. Have you got an overview how alcohol taken, ethanol, it is reaching the liver? In the liver cell, have you got the overview? Now this is a liver cell. Let me draw a liver cell for you. This is a liver cell. Now inside this liver cell, this is ethanol entering. This is ethanol entering inside the liver cell. Ethanol. So ethanol is the alcohol. It is acted upon by two enzymes one by one. So the first enzyme here is alcohol. Alcohol dehydrogenase. Alcohol dehydrogenase is the name of the enzyme that convert alcohol into acetaldehyde. Acetaldehyde. Ethanol get converted into acetaldehyde. The second enzyme which act on acetaldehyde, the name of the enzyme is acetaldehyde dehydrogenase. Acetaldehyde dehydrogenase. That is acting on acetaldehyde and converting acetaldehyde into acetate. And ultimately acetate get converted into CO2 and H2. You will say, ma'am, it is the best thing. So whatever alcohol consumed by a person, that get converted into H2O and CO2 and that will be excreted out of the body. CO2 is excreted in breathing and H2O is excreted in urine. You will say, ma'am, it is the best thing. Why it is causing cirrhosis then? Okay. So ultimate conversion depends on two enzymes. The enzymes are important. What is the name of the two enzymes? The first enzyme is alcohol dehydrogenase. That is converting alcohol to acetaldehyde. The name of the second enzyme is acetaldehyde dehydrogenase that convert acetaldehyde to acetate and CO2 H2O ultimately, right? So God has given this enzyme abundant in the liver. There is no problem in that. But the second one is limited. इसमें थोड़ी कंजूसी रह गई. So this one is limited, right? So this enzyme is not too much. Now imagine two persons. The first person is taking alcohol in small quantity. He is taking daily. He is a chronic drinker but taking only one pack or half pack. So he is taking small quantity of alcohol daily. So there is no problem. So the first enzyme is abundant. The second limited भी है लेकिन इसके लिए sufficient है because the person is consuming small quantity, so that is sufficient for that quantity. So all the alcohol ultimately gets CO2, H2 and it will not cause cirrhosis or any problem. Give me a thumbs up. But imagine a person is taking large quantity of alcohol daily, chronically, 4 pack, 5 pack. He's drinking bottles over bottles, right? So he's consuming large amount of alcohol daily. What will happen? You tell me what will happen. What will be the problem now? What will happen now? So here the first enzyme is abundant as I have told you, so there is no problem. All the alcohol which is consumed by the person will get converted into acetaldehyde, but the second enzyme is limited, so the amount of the alcohol is too much, so acetaldehyde cannot be converted into acetate and H2O CO2, so acetaldehyde will accumulate in the cell and unfortunately, acetaldehyde is toxic for hepatocyte. It will cause hepatocellular injury. So actually, hepatocellular injury is not caused by ethanol. It is caused by the metabolite of ethanol, which is known as acetaldehyde. Give me a thumbs up. So that is the complete metabolism, ethanol metabolism. The same story is written in front of you. Give me a thumbs up if you got the story. Give me a thumbs up if you got the story. Have you got it? So the same story is written. So ethanol get converted to acetaldehyde. Acetaldehyde get converted to acetate and ultimately H2O CO2 is formed. Two enzymes are required. You can see the name of the two enzymes. The first enzyme is alcohol dehydrogenase, which is abundant, and second is enzyme is acetaldehyde dehydrogenase, which is limited. Right? So that is the complete story. So it is the acetaldehyde which is toxic. If you can see, it is written here. It is toxic. So if someone is consuming large quantities of alcohol, all the alcohol get converted into acetaldehyde. Yes, this conversion will take place. But acetaldehyde cannot be converted into acetate because the second enzyme is limited. It is a rate limiting step. So acetaldehyde will accumulate and that is toxic. That will cause injury. Right, injury. Yeah, that will lead to cirrhosis, Chungu. Absolutely. Right. So actually hepatotoxic is the acetaldehyde. So you can see in this diagram, this is the alcohol. If the person is drinking alcohol in high quantity, in large quantity, if the person is drinking the alcohol, all the alcohol will go in the GIT. From GIT, it will be absorbed. It will go to the liver. In the liver, it will convert it into acetaldehyde, and that acetaldehyde will cause injury to the liver, and liver will be cirrhotic. So that is the complete story we have understood. Now on. Let's come on the histopathology of cirrhosis, which is important. ये तो pathogenesis हुआ. After pathogenesis, coming on the histopathology of alcoholic cirrhosis. There are three stages. In alcoholic cirrhosis, there are three stages. First, alcoholic steatosis will happen. That is known as fatty liver. Then alcoholic hepatitis will happen. That is known as steatohepatitis. And then alcoholic cirrhosis will happen. So there are three stages. First, alcoholic steatosis will happen. Then alcoholic hepatitis will happen. And then alcoholic cirrhosis will happen. This is stage 1, this is stage 2, this is stage 3, and ultimately cirrhosis will be there. That is the end stage liver. Everyone give me a thumbs up. So three stages are there which happens in sequence. It is not directly cirrhosis hota hai. Cirrhosis occurs over years. If someone is drinking since last 10 years, last 20 years, then cirrhosis will happen. So gradually, it is not cirrhosis a one-day job. Someone drinking too much of alcohol today, tomorrow cirrhosis will happen. No, it takes place over years to convert the normal liver into cirrhotic liver. And still, it is not the first stage. First cirrhotic stage, steatotic will happen. So if some patient is coming to me, he is already having stage 1, that is steatotic liver. I will advise the patient to quit alcohol. From today, don't drink alcohol. Do the abstinence of alcohol. It is reversible. After few years, your liver will become normal. If he follows my advice, it's good. If he or she is not following my advice, second stage will happen. So he will come to me at alcoholic hepatitis. Still, at this stage also, I will advise the patient to quit alcohol, to do the abstinence. Still, if the patient is following my command, it is also reversible. But if he is not following my command, ultimately cirrhosis will happen and there is no need of leaving the alcohol now. Whether you drink or not drink, the liver is gone and this stage is irreversible. So first two stages are reversible. The last stage is irreversible. Everyone give me a thumbs up. Everyone give me a thumbs up. These are the three stages. Have you got it? So in this diagram, you can see, and the three things together is known as, it is a sequential stages. It is known as alcoholic liver disease. ALD, alcoholic liver disease. So alcoholic liver disease includes three things. Alcoholic liver disease includes three things. The first thing is alcoholic steatosis, then alcoholic hepatitis, and then alcoholic cirrhosis. Everyone give me a thumbs up. Shall I proceed ahead? Now, alcoholic steatosis is known as fatty liver. Alcoholic steatosis is the fatty. You can see a beautiful diagram from the Robbins. Robbins is the Bible of pathology. You must read entire Robbins if you want to study pathology. Now, most of the students say me, ma'am, Robbins is a difficult book. The language is difficult. So here I am to simplify Robbins for you. So basically, I'm just simplifying the Robbins. I'm making Robbins cakewalk for you. So just watch my lectures. Listen my lectures carefully and after that read Robbins. You will find everything is already covered in my lecture and the only reading portion is remaining, right? So okay, see the diagram from the Robbins. You can see a normal liver. If someone is drinking alcohol, exposure is present. So the first stage is steatosis. This is stage 1, steatosis. Now see the arrow. I will advise this patient to do the abstinence to quit alcohol. So it is reversible. And if it is not following my command, it will convert into stage 2. Stage 2 is hepatitis. This is stage 2. Still, I will advise the patient to leave alcohol to do the abstinence. Still, it is reversible. it is reversible. And if the patient is not following the commands, and ultimately it will continue the exposure, it will convert it into cirrhosis, and from cirrhosis you are not finding any arrow like this. No, cirrhosis is irreversible. Have you got this diagram? Have you got this diagram? Cirrhosis is irreversible. Now I'm going to show you three diagrams. You already know the basics of the histology of liver. You know lobular model. Yes, I guess everyone knows the lobular model. Okay, so I will draw three diagrams for you for the three stages. For the lobular model, uh, you already know entire liver is having hexagons, the lobules. At the center, there is hepatic vein. At the, I'm sorry, just a second. Entire liver is made up of lobules, the hexagonal lobules. At the center, there is hepatic vein or central vein. And at the periphery, portal triads are present. We all know that each portal triad contains three things: the hepatic artery, portal vein, and bile duct. So three things are present everywhere. You all know. Now in the diagram, I will draw one central vein and one portal triad. I will not draw all six portal triads, right? So this is the diagram of stage 1. What is this diagram about? In this diagram, whenever any diagram of liver is shown to you, you have to see two things. Where is the central vein? Where is the portal triad? So look at the diagonals. Look at the corners. Can you see this diagonal? This is showing central vein. This is the central vein, which is now, imagine it is present at the center of the lobule. Compare it with the lobular model and see the other diagonal. Other diagonal is showing portal triad. You got my point? So out of the six portal triad, only one is drawn here. I cannot show all six here in this page. So you can imagine the complete diagram. Everyone give me a thumbs up. So this is the central vein, this is the portal triad. You can see the cords of hepatocytes connecting them. Give me a thumbs up. The cords of hepatocytes are connecting them. Right? Now in the cords of the hepatocyte, this is stage 1. I am teaching you stage 1. Stage 1 is steatosis. Steatosis, also known as fatty liver. Right? Three things will happen in the hepatocytes. In the hepatocytes, three things will happen. The first thing, can you see all these hepatocytes I am marking for you? See all these hepatocytes I'm marking for you. In all these hepatocytes I'm marking for you, you can see the shape is like a flower. Floret. It is looking like a floret. Floret. What is this floret about? Okay. So this is the hepatocyte, right? This is the nucleus of the hepatocyte, right? This is the nucleus of the hepatocyte. In the cytoplasm of the hepatocyte, the fat will accumulate in the form of small vesicles. This is microvesicle. Microvesicle. Multiple microvesicle will accumulate at the periphery, and it is looking like a floret. Yes or no? It is looking like a floret. Navirapin, yes, it is a live class, and I have already read that you want a gallstone class. So definitely I will schedule it in my lectures ahead on the YouTube or Unacademy special class. So stay connected for that. But currently I am teaching you cirrhosis. So the next 3 lectures are cirrhosis only. They are already scheduled. But in the further classes, I will definitely try to schedule it. Okay. So shall I proceed now? Okay. So have you seen, this is the hepatocyte. In this hepatocyte, you can see multiple small fatty vesicles are present at the periphery. So this is microvesicle. So first multiple microvesicles are formed. After formation of multiple microvesicle, what will happen now? See, again, this is the hepatocyte. This is the nucleus of hepatocyte. All these microvesicle will fuse with each other. All these microvesicle will fuse with each other, and they will form a big vesicle, and they will push the nucleus to the periphery. The nucleus will be pushed to the periphery. This is known as macrovesicle. Macrovesicle will be formed, and in the end, multiple macrovesicle will also fuse with each other, and a big cyst is formed. This is known as fatty cyst. You got my point? You got my point? So 3 things will be there. First, a microvesicle that will convert into macrovesicle, and that will convert into fatty cyst. So how the conversions take place? See the diagram again I am drawing. Here is the nucleus in this diagram. Here is the nucleus in this diagram. In the third diagram, no nucleus. You can see microvesicles are there in the first diagram. Multiple small fatty vesicles are present at the periphery. You can see they all fuse together and shift the nucleus to the periphery. This is macrovesicle, and multiple macrovesicle fuse with each other and they form a fatty cyst. So ultimately fatty cyst is formed. Now these, you can see the 3 things here in this diagram. See at one end, this is the central vein. See at other end, this is the portal triad. Connecting them is the row of hepatocytes. You can see inside the hepatocytes which I have drawn, the red color, all are microvesicles. See the shape, they are flower-like. Now I am using another color, the green color, to show you macrovesicles. How many I can see? I can see many. In all of them, the nucleus is shifted to the periphery. The nucleus is shifted to the periphery. I can see many. All these are macrovesicle. After that, I can see the fatty cyst. I can see 2 fatty cysts in this diagram. So give me a thumbs up. So some of the hepatocytes are showing microvesicle, some of the hepatocytes are showing macrovesicle, and some of the hepatocytes are showing fatty cyst. That's it. That's it. So some are micro, some are macro, some are fatty cyst. So only three changes are there in stage 1. In stage 1, three changes. Microvesicle, macrovesicle, fatty cyst. Micro give rise to macro, macro give rise to fatty. That's it. Done. The stage 1 is done. Coming on stage 2. What is stage 2? It is alcoholic steatohepatitis. Oh, itis. Itis in pathology is inflammation. Itis in pathology is inflammation. Right? So see the diagram. Again, in all diagram, I have asked you to search at the diagonals. At the diagonals, search for the central vein, search for the portal triad. Where is the central vein in this diagram? I guess this is the central vein. Where is the portal triad? I guess this is the portal triad. Have you found the central vein? Have you found the portal triad? Now connect them with the cord of hepatocytes. Here, in the cord of the hepatocytes, you will find two type of injuries in the hepatocyte. Can you see all these hepatocytes I am drawing with red color? These all hepatocytes are swollen with a granular cytoplasm. They all are swollen with a granular cytoplasm. This is known as balloon degeneration. Balloon yani gubbara, right? So they are looking like the balloon because they are swollen. That's why known as balloon degeneration. Number 1. Number 2, see the hepatocytes I am drawing right now with green color. Can you see this one, this one, this one, this one in this image? So these hepatocytes, see the cytoplasm of these hepatocytes. In the cytoplasm of these hepatocytes, you can see pink color inclusion body. These cells are known as Mallory hyaline cells. Mallory hyaline dank cells, right? So that's the second type of injury. So first is some of the hepatocytes show balloon degeneration, some of the hepatocytes show Mallory hyaline body. And see the background. The background. In the background, you will find numerous neutrophils. You are finding numerous neutrophils in the portal triad also. Can you see all the neutrophils? These all are multilobated neutrophils. In the portal triad, see the three things. This is artery, hepatic artery. This is vein, portal vein, and this is bile duct. Apart from it, neutrophils are present. And neutrophils are also present between the cords of the hepatocyte. That is inflammatory infiltrate is there. So neutrophilic infiltrate is there, right? So this is the 3 points. Fourth, I will tell you. First, understand the 3 points. So in stage 2, 4 things are there. I am teaching you stage 2. The first thing is balloon degeneration. Some of the hepatocytes show balloon degeneration. Some of the hepatocytes show Mallory dank body. Mallory dank body means eosinophilic inclusion bodies in the cytoplasm. The third is the neutrophils. The background have the neutrophils. Now, last thing I will tell you is the fibrosis. You will say, ma'am, I can't see fibrosis in this diagram. Even I can't see fibrosis in this diagram. Fibrosis is very small here and we cannot see on HNE stain. This stain is HNE stain. For looking for fibrosis, you have to do trichome stain. For looking fibrosis, for searching for fibrosis, you have to do trichome stain. Now this is a trichome stain. On trichome stain, fibrosis is blue color. Where is the fibrosis? This is the same slide. Instead of HNE, we have done the trichome stain. Now, where is the fibrosis? I can find out fibrosis with blue color. I am marking with red. So this is all fibrosis. Actually, fibrosis is around. Fibrosis is around individual cell. Individual cell. Around each individual cell, there is fibrosis. Give me a thumbs up if you got my point. Now, this is known as chicken wire fence appearance. What do you mean by chicken wire fence? ये किसी को पता नहीं होता है. Chicken wire fence क्या होता है? मुर्गी का पिंजरा. Chicken wire fence, right? So have you seen the मुर्गी का पिंजरा? How it does it look? Chicken fence, chicken wire fence. So it is like the fibrosis around individual cell. That is the fibrosis around individual cell. It is looking like that. So this appearance, see, this appearance is looking like that. It is known as chicken wire fence appearance. It is seen on trichome stain. So these are the 4 findings. So till now, I taught you 2 stages. There are total 3 stages. Alcoholic steatosis, the first stage, fatty liver. Alcoholic hepatitis, inflammatory stage, the second stage. And alcoholic cirrhosis, the last stage I am going to teach now. In the first stage, only 3 findings are there. 1, 2, 3. First finding is microvesicles are formed, floret-like. The second finding, macrovesicles are formed. So all the macrovesicles fuse and push the nucleus to the periphery. And ultimately, multiple macrovesicles fuse with each other and fatty cyst is formed. Right? So only 3 findings are there. In the second stage, 4 findings are there. 1, 2, 3, 4. What are the 4 findings? Can you tell me? The first thing, balloon degeneration. You know what is balloon degeneration? The hepatocyte will swell with granular cytoplasm. Then second is Mallory dank bodies are formed. Mallory dank bodies means in the cytoplasm, multiple eosinophilic inclusion bodies are present. After that, neutrophilic infiltrate. Yes, Chungu, it is acute inflammation. That's why neutrophilic. Right? And last is fibrosis. There is a special name to this fibrosis, chicken wire fence fibrosis, because fibrosis is around individual cell. Everyone give me a thumbs up. Do not write these findings. Understand these findings in the diagram. Once you have seen the diagram, you will never forget. Shall I come on the last? That is cirrhosis, the last stage. So last stage is cirrhotic stage, the third stage. So I'm starting the third stage, cirrhosis. The gross is also important. So look at the gross. In cirrhosis, the entire liver converted into micronodule. See, all the nodules are less than 3 millimeter in size. So it is known as micronodular liver. Have you got it? Chungu, Shifa, have you got it? So all the nodules are less than 3 millimeter. It is micronodular. It is looking like the sole of a foot, the sole of a shoes. Have you seen such shoes? The sole of the shoes contain nails. It is an old-fashioned shoes. The sole of the shoe contain nails. It is known as hobnail shoe. The name of the shoe is hobnail. Google it out. Hobnail shoes क्या होते हैं? Go on the Google images. You will find such shoes. Shoes with nails on the sole. It is known as hobnail appearance. So the appearance of the liver is hobnail appearance. It is known as, right? So everything is correlated if you know the details. So this is the hobnail liver. This is gross. The last thing is the microscopy. This is the microscopic diagram of stage 3. In stage 3, don't search for the diagonals, the central vein and the portal triad because lobular model is gone now. There is no lobular model. The complete nodules are there. You can see multiple nodules and all these nodules contain hepatocytes, the regenerating hepatocytes. So few surviving hepatocytes are there which regenerate and filling the lobules or filling the nodules. So no lobule, it is nodule. Multiple nodules are there, micronodules, which are formed by regenerating hepatocytes and the nodules are separated from each other by fibrous septa. So there is fibrous septa. This fibrous septa is formed by E2 cell which converted into myofibroblast and form collagen. That's all about it. So we are done. So here if you do trichome stain to see the fibrosis. Can you see the blue color fibrosis here in this diagram? It is around the nodules. It is not around individual cell. It is around the nodules. So this is not chicken wire. वहाँ पे chicken wire था. So I am done with alcoholic liver disease. The 3 type of alcoholic liver disease I am done. The first is alcoholic hepatitis, then alcoholic cirrhosis. I'm sorry. The 3 type of diseases, alcoholic liver diseases I am done. The first is alcoholic steatosis, known as fatty liver. The second is alcoholic hepatitis, that is inflammation. That is injury and inflammation. The third is alcoholic cirrhosis end stage, in which the liver convert nodular. Yes, I am done. Anyone having any doubt till now? So out of the cirrhosis, the first cirrhosis is done by my side. That is alcoholic. These are the 3 stages. Alcoholic cirrhosis, right? The second cirrhosis, there are few questions based on that. After the first cirrhosis, the second after that is post-necrotic cirrhosis, hematochromatoses cirrhosis, Wilson cirrhosis, alpha-1 antitrypsin deficiency cirrhosis, cardiac cirrhosis, Indian childhood cirrhosis. I will teach you all cirrhosis, but it will take time. So gradually in the next session, in the next episode, I will continue with cirrhosis and teach you remaining cirrhosis. Right? Are you people interested? Would you like to do some questions? Can you tell me the answer of this? On stopping alcohol, all of the following stages are reversible except which is irreversible. Can you tell me the name of the stage which is irreversible? Is it hepatitis? Is it cirrhosis? Is it microvascular? Is it macrovascular? Which stage is irreversible? Can you tell me the answer? It's very easy. I taught you 3 stages. The last stage is irreversible. So yes, Shifa, absolutely right. Yes, Gajanan, absolutely right. So it is cirrhotic stage. These 2 indicate stage 1. That is steatosis mein hota hai ye. So it is reversible. Or inflammation occurs in stage 2. So this is stage 2. So yes, everyone. Harish, Siddhika, Gajanan, everyone is right. Right? So correct answer here is B. The next question is in front of you. Pathological manifestation of chronic alcoholism include all of the following except. So which is not a feature of alcoholism. I'm including all 3 stages. I'm not asking the question about some particular stage. I'm including all 3 stages. So to read the questions. So piecemeal necrosis होता है कि नहीं होता है? You tell me. Balloon degeneration होता है कि नहीं होता है? Microvascular fatty change होता है कि नहीं होता है? और central hyaline sclerosis होता है कि नहीं होता है? You tell me what is the correct answer here? What is the correct answer here? Yes? So piecemeal necrosis is the answer. Piecemeal necrosis takes place in hepatitis, not in cirrhosis, not in alcoholic liver disease. Piecemeal necrosis I have discussed in the morning. No. So balloon degeneration takes place. Microvascular fatty change take place. Balloon degeneration take place in stage 2, right? Microvascular take place in stage 1. Or central hyaline sclerosis is the Mallory Dank bodies that take place in stage 2. But piecemeal necrosis is not a choice here. Yes, you are right. Gajanan, Siddhika, absolutely right. Right? So, okay. Just a second. Mallory hyaline bodies, Mallory Dank bodies. Mallory Dank bodies का composition क्या है? Mallory dank bodies are the inclusion bodies, deep pink eosinophilic bodies which are made up of cytokeratins. Please learn that. They are made up of cytokeratins. They are seen in which disease? Of course, they are seen in alcoholic liver disease. So answer is C, right? Okay. Okay, the questions are easy. You tell me in cirrhosis which type of collagen is formed by E2 cell. There are 6 type of collagen. No? E2 cell form which type of collagen? Is it type 1, 2, type 1, 3, type 4 or type 1, 4? What is the correct answer? In my notes it is written but I forgot to tell you it's type 1 and 3. Type 1 and 3 type of collagen is formed by these cells. Right? Okay. Yeah. Can you tell me the answer of this important question? Micronodular cirrhosis is seen in all except. It is seen in all except. So tell me the condition in which micronodular cirrhosis is not seen. Macronodular is seen. Rest all में micronodular होगा. Yes. What is the correct answer here? What is the correct answer here? In macro, all of them are micronodular except only 2 which are macro. Macro में आपके से दो examples हैं. Number 1 Wilson disease, that is copper excess, and number 2 it is post-viral cirrhosis, post-necrotic cirrhosis. So it is chronic hepatitis B. A will be the answer here. That is macro. Rest all are micro. You got my point? So this is the next question. Again the same question with different options. Micronodular cirrhosis is seen in all of following except. Again I told you all of them are micro, only 2 are macro. Not the macro. So it is Wilson and post-viral, right? So here Wilson will be the answer. Wilson, rest all are micro. So macro में सिर्फ 2 ही example आते हैं. In the macro only 2 examples are there. Post-viral and Wilson. Rest all are micro. Again and again I am saying the same thing. So I am done with the first cirrhosis, alcoholic cirrhosis. The next cirrhosis I would like to take is NASH. That is non-alcoholic fatty liver disease or non-alcoholic fatty hepatitis. So NASH or NAFLD or NASH, one and the same thing. So but that I will take in the next session, in the next episode. So stay connected for episode 2 which will be there in the night. So today night, late night, I will take the session maybe at 10 or 10:30 around, in which I will continue the remaining cirrhosis. I will continue with NASH. After that, I will come on hemochromatosis, Wilson's disease, post-necrotic, alpha-1 antitrypsin deficiency. In the sequence, I will cover all cirrhosis in these episodes, right? And after that, we will come on the jaundice. Thank you very much for giving your precious time to me. And I expect that you have understood the topic completely. Still, if you have any doubt, you can get connected with me on Telegram. I'm available on Telegram. On Let's Crack NEET PG group of Unacademy. Let's Crack NEET PG group. It's a Telegram group of Unacademy. My Telegram ID is MedLife by Dr. Priyanka. Search me in the members by this name. MedLife by Dr. Priyanka. This is my Telegram ID. Priyanka. Right? I'm Dr. Priyanka Sachdev. Right? So search me on the Telegram and text your doubts on the Telegram. Stay connected on the Telegram. And today morning, I have taken a 4-hour free session. Like YouTube only, it's free. But it's on Unacademy app. So you have to install Unacademy app to watch that session. In that session, I taught completely all type of hepatitis, right? In the morning only, right? So hepatitis A, B, C, D, E. After that, acute hepatitis, chronic hepatitis, fulminant hepatitis. We covered everything. The recordings are available and you can watch the recording anytime. Thank you very much for being with me. Yeah, one more thing. These recordings are free. You can watch it on the app. Install the app and watch the recordings. They're free. The only thing you require a code to unlock the recording if you are a newcomer. So code is my surname, Sachdev. Sachdev. Sachdev 10 without space 10. It is the code you can utilize. The same code you can utilize for the subscriptions of Unacademy for taking 10% discount. So there will be 10% discount and price hike is going to take place soon on all the subscriptions. On Unacademy, we are having plus subscription, iconic subscription, Prof 1 subscription, the test series, light subscription, various subscriptions are available. In iconic subscription, along with Unacademy recorded live and recorded lectures, you will get prepared also. So various plans are available. You can check the plans and whatever plan you are planning to purchase, apply the code Sachdev10 before payment if you want to get the discount. And price hike is coming soon. The new batches for 2023 are already started on the plus courses. So take the subscription and take the benefit of that. Thank you. Bye-bye. Study hard. All the best. I'm ending this